Hi guys, Dr. Cramer here from Lakeview Pet Hospital. This is my technician Cassidy, and our model today is PJ. She's a great little girl, and what I'm going to demo is a physical exam. So very important to have complete physical exams in order for us to pick up on things that the dogs are communicating with us. Even though they can't talk, they can communicate. So I always start at the front and we work our way to the back. So we'll start with the eyes. I look at the eyes with the naked eye to start with, and then I'll start looking at them with a panoptic scope. We don't routinely dilate dogs' eyes, so this panoptic scope allows me to look in the back of the eyeball at the retina. That gives me tips on whether the dog could potentially have high blood pressure, diabetes, glaucoma, retinal degeneration, retinal atrophy, all those kind of things. So very important on that. Then we go to the teeth. Most smaller dogs tend to have not as good a teeth, so we always look at both top and bottom, and I always look way in the back. The next part I go to is the lymph nodes. There's several lymph nodes that we can easily palpate on a dog. There's mandibular ones up underneath the chin, there's axillary, which are under the armpit, there's some inguinal ones, and then there's some popliteal on the back legs. You should be checking those every single time. Those are giving you indications of any infection, cancers, stuff like that. Next thing I go to is the ears. I have a couple of scopes that I use to help me with that. The otoscope allows me to see deep down into that ear canal, looking through the vertical ear canal, the horizontal ear canal, and the eardrum, tympanic membrane, all those structures. The next thing is a skin turgor. So we just simply tint the skin up right there and let it go. What we're doing there is assessing for dehydration. The next thing is the heart and the lungs. So we'll get a good listen on both sides, the left and the right. We're listening for any type of arrhythmia, any murmur, which are abnormal beats, or potentially blood going backwards into the heart for congestive heart failure, or going into the lungs. Anything abnormal with that. At the same time, I'm feeling a pulse to make sure we don't have any pulse deficits. Again, could also allude to some cardio issues. Working our way from front to back. The abdomen is the next, so we always palpate the abdomen. What I'm checking for here is any type of hernia, masses, tumors, lumps, bumps, pain. Anything that's abnormal at all. And if you hit the right spot, if a dog is painful, if they've got pancreatitis, for example, and you're up in that cranial abdomen, they will let you know. Again, dogs, even though they can't talk, they can communicate. Working on back. Depending on what region you are, you may look for this, you may not. Here in Oklahoma, we look for fleas and ticks on every single animal. So I'll usually, and fleas like to hang out right here at the base of the tail, so I'll always put that skin backwards, or part the hair backwards to see if there's any fleas or flea eggs, and I also have a flea comb that we will go through every single pet. We lift up the tail. We will check out any rectal structures. We take a temperature. We'll get a stool sample there if we have to. Again, we've got lymph nodes back here. And then to finish up, we're going to do a orthopedic exam. So we'll start with flexion and extension of every joint. So the wrist, the elbow, and the shoulder. Same thing for the back legs, the ankle, the knee, and the hip. We'll put them all through range of motion to make sure we're not getting any crepitation, any pain, any resistance on range of motion. After being in this profession for almost a decade, I can tell you without a doubt, the most diagnostic tool we have is a physical exam. Very important to be getting these done. I hope that kind of clears things up. Thanks, guys.